Assalamu alaikum everyone. Inshallah you're all doing well. Today we'll be talking about the bacterial causes of pneumonia. So as you know from our pathology PowerPoint, there is a whole slide on bacterial pneumonias, and there are a lot of bacterias, 8 to be specific, and those 8 bacterias, they have some key features for each of them, okay? And it might be difficult for you to correlate each feature with each bacteria, and memorization might be difficult. So this is why I made this story that will inshallah tackle this problem, and inshallah it will be very helpful. So at the beginning, I know that the 2 slides here, they might seem scattered and all over the place, but inshallah at the end of this video, inshallah it will be very clear, okay? So the story is called Homes of 3, okay? Homes of 3. Homes, we mean like a home, right here, a home, and of 3, because we have 3 members. So usually, when we have a home or a house, what members live in the house? We have the father, we have the mother, and we have the child, right? So for this H right here, it stands for Haemophilus or H influenza. And as you know, influenza, it's more common in children than in adults. This is why, and this is just to correlate them, this is why H influenza, it will be associated with our child character in this case, right here. Very handsome, okay? And the O, we'll talk about it in a bit. And then M, think with me, M stands for mother, okay? M, mother, okay? And the mother character, it will be associated with also another M here, which is Moraxella catarrhalis. So now I want you to close your eyes and say Moraxella catarrhalis. Moraxella. It's like a girly name, صح? So Moraxella, it's more of a girly name than a guy name, just by the sound of it, So this is another way to remember that Moraxella, it's related to a girly character, and in our story, it's the mother, okay? And we have lastly the S, which is the father, and this character will be associated with, it will represent strep pneumonia in our story, our pneumococci, okay? And we'll talk about the father and his story in a bit. But before we move to that, we'll talk more about the child and the mother, and we'll start with the O as well. We want to talk about the O. So here O stands for otitis media. Let's break down the word. OT here means ear. Itis, as you all know, it means inflammation. And media, it's like middle, okay? So it's inflammation or infection of the middle of the ear, okay? And why is this here? Because it is a common feature between all of those 3 bacteria, okay? It's a common feature that all of those share in common, okay? Okay. Now, we'll start with the first character, the mother. So actually, the mother, she's an old person in our story, and she's elderly, okay? So that's why we wrote elder here. And unfortunately, she has COPD, okay? And since she has COPD, she inherited this COPD to her child. So now the child is inherited, or he has COPD now. He inherited the COPD, okay? But how does this connect to our our story, our bacteria lecture? I'll tell you. So H influenza, it's the most common cause of, I wrote here COPD, but it's actually the most common cause of acute exacerbation of COPD. So it makes the COPD that's there worse. It has it induces acute exacerbation of it, okay? It's the most common cause. And the mother, as we mentioned, here, Moraxella catarrhalis, it affects more of the elderly patients, and it's the second most common cause of causing acute exacerbations of COPD. Okay? Okay. Now with the father. So the father actually, it's a very interesting story, okay? But before we move to it, the father, we have here strep pneumonia, right? Strep, because the father, he's a strips master. You know the strips, the ones you buy and you eat. So he's a strips master. He's so good at them, very good. And this is why, because of how good he was assigned by McDonald's themselves. So now he works at McDonald's, which is at a food court, by the way. And this will connect later to our story. And this is his workplace. And now before we move to the rest, the father, he's a family man, okay? And he always says something that's very heart-touching, heartwarming, fruitful, nice. It's mesmerizing, really, okay? What is this thing? He always says, I have 2 positive things in my life. My wife and my kid. So here, 2 and positive, they represent gram-positive diplococci. So strep pneumonia is a gram-positive diplococci, okay? And he also adds to what he says here, I would give my spleen to them. This is how much he loves them. Yani imagine, I would give my spleen to them. And this is associated, or this is correlated to strep pneumonia, as splenectomy is a risk factor for developing or getting infected by strep pneumonia. طب why? Now we'll talk clinically or medically. Because strep pneumonia has a very virulent factor, has a strong virulent factor, which is that it's encapsulated, okay? It's in a capsule, protected. And usually in our body, our spleen is the thing that is very good at getting rid of these encapsulated organisms, okay? Like strep pneumonia here, okay? This bacteria. And this is why if we have splenectomy, we remove the spleen, getting strep pneumonia, it will be much more common. That's why it's a risk factor if you have splenectomy, okay? Okay. Now, as we said, the father works in McDonald's. Now he got assigned to McDonald's. They're the ones who told him, come to us, because he's a strip master. He's very good in making strips. Okay. So his workplace, McDonald's, starts with an M, right? And as we said, it's in a food court, of course. And this is the food court right here. And we call it the contaminated food court. And you'll know why later on. So McDonald's, the M stands for Mycoplasma pneumonia. And as you know, McDonald's in a food court, you're imagining a closed space. And before we actually move to this point, I forgot to mention one thing about strep pneumonia. Since the father is working at McDonald's, as we mentioned, it's community, right? It's not a hospital, he's working in a community. So this is why strep pneumonia is the most common cause of community-acquired pneumonia. Okay? And now to touch on the second point, M for McDonald's is Mycoplasma pneumonia. And as we said, it's a closed community in the food court, right? So this is why people who are going to eat from McDonald's, they're like going to get infected. And it's closed, so it's going to cause an epidemic in closed communities. In our case here, it's like food courts. But actually, it's like in schools, closed communities like in schools, like in prisons, okay? Okay. طيب, you might ask, why are we getting those infections? This is bad and everything. I'll tell you. It's because of the staff of the place. The staff of McDonald's, actually. They are not hygienic. They need to be hygienic. And it's a bit off topic what I'm going to say, but it's very important to keep in mind. Staff, they're not clean, they're dirty. So hygiene is important to prevent pneumonia. It's one of the things to prevent pneumonia, it's the hygiene. And in this case, the staff is what? They are not clean, they're not hygienic, they're dirty, okay? So, people who go there, whether it's a child or an adult, they're gonna eat the food from McDonald's, and they're gonna get infected. طيب, ask yourself this question. When they get infected from this food, like this is the first thing they get infected from, right? The direct thing. Is that the root cause? It isn't. The root cause is the staph, which is it's the secondary, or it's the root cause. This is why, and this is how it's connected, Staph aureus, it causes a secondary infection upon the primary infection, okay? And usually that primary infection is viral. So Staph aureus, now we're talking medically. Staph aureus, secondary infection, secondary bacterial infection to a primary infection that was there, and it's usually viral, okay? Okay. So one day, the child, he comes back from school, goes to his home, and let's say it's like on a Friday, for example. So it's weekend now. And he wants to go out, and the mother as well, she wants to go out, and they want to go see their father, their lovely father. And they also want to, enjoy themselves and get food and everything. So the mother and the child, they take a taxi and they go to the food court where the father is. Okay? When they enter the food court, something very odd happens. They see something very weird, something very odd. There was a poor man there, okay? And he was selling clips. You know the paper clips? The clips. So those clips, and I spelled it this way for a reason. The K here is for Klebsiella, Klebsiella, like clips. Klebsiella pneumonia. And as we said, it's a very odd thing for a poor man to be in a food court selling clips as well. Very weird, very odd. So very odd, it's for negative gram or gram-negative bacteria. So this is why Klebsiella, it's a gram-negative bacteria. And this man, as we've mentioned, he's poor, he's debilitated, he is malnourished. So Klebsiella, it favors or it attacks more, or it infects more people who are debilitated, people who are malnourished, people who are diabetic, smoking, alcoholic, all of those things, okay? So this is how we connected to this. And actually, because of how sick this man was, he was coughing red, current, thick, gelatinous sputum, okay? This is how sick he was. He was coughing this out, okay? And this is actually a very important feature of Klebsiella pneumonia that it causes. It causes this red, recurrent, thick, gelatinous sputum, okay? And something that is related to actually the microbiology lecture we've taken, and it's actually something that's very important we need to know, is that Klebsiella, it's a hospital-acquired bacteria, okay? More commonly. So this is why, in this case, obviously, such patient or such poor man, he needs to go to the hospital, right? So this is how we connect it to HAP, hospital-acquired pneumonia, which is a common cause, which Klebsiella is a common cause of, okay? Okay. So they see this thing in the food court, they see the man, and they're like, okay, they were planning to give him food and everything. So they go down, they sit down, and they order food. And while they were ordering the food, guess who the child saw? Who the child, in our case, the kid saw? He saw his older teenager troublemakers in the food court as well, okay? And as you see, they're troublemakers. They are troublemakers, of course, okay? So, moving to the seventh bacteria, Pseudomonas aeruginosa. Pseudo means fake. Fake is bad. And bad, what is also bad? It's vape. Please stop vaping if you are, okay? Vape is very bad, okay? Very bad, okay? So this is how we connect Pseudomonas aeruginosa with VAP. And medically بقى, here when we say vape, it means ventilator-associated pneumonia. And obviously ventilator-associated pneumonia, ventilator, it's in hospitals. So this is why Pseudomonas aeruginosa, It's most common cause of hospital-acquired pneumonia, okay? So those teens, troublemakers, they vape, but they also have something weird, a pen. But why do they have a pen? It's because they are lacking behind on studies. Their academic performance isn't the best, and their parents are very strict with them now. They tell them now you have to go and finish your homework. Please finish your homework, even if you're going to go out. So they have a pen and they also write with it. So طيب, what does pen have in relation to our story here, or for Pseudomonas aeruginosa? I'll tell you. It might be a bit far-fetched, but bear with me, okay? So P and N is for neutropenia, and the E is for extensive burns, okay? Okay. And now the child, he looked at them and he's like, it's fine, I'll ignore them. He eats with his mother, he enjoys his time, and then he goes to wash his hands, okay? Guess what? Even in the bathrooms, they weren't free from contamination, okay? Even the bathrooms in that food court wasn't clean. So now the kid and the mother, they go to wash their hands with contaminated water. What is associated with water? What bacteria? Legionella pneumophilia. Legionella pneumophilia. And we say pneumophilia here because it's lung-loving. This is the translation of it, by the way. Okay? So by that, we conclude our story for today. Hopefully it was helpful. But before we end it, there are a couple of things you should keep in mind that I did not include in the story that are in our slide, okay? And this is it. For Staph aureus, okay, I couldn't connect those two things that you should keep in mind, and they're very important. They're also associated with lung abscess and right-sided staphylococcal endocarditis in IV drug users. I think this one we know from CVS, okay, for the IV drug users one. So keep those two in mind. And for Legionella pneumophilia, a very important risk factor is organ transplant recipients, okay? So keep those things in mind. And as I said, inshallah, this was really helpful. And don't forget us from your du'as. And assalamu alaikum wa rahmatullahi wa barakatuh.